Well, eating disorders used to be three in number. There was anorexia nervosa, bulimia nervosa, and compulsive eating, excessive eating, in other words. There are some additional ones. The three I've just mentioned are the commonest. Bulimia nervosa is probably the commonest. Bulimia nervosa means that the person, it can occur in both men and women, more commonly in women than men, but it can occur at any age, usually in the teens and early 20s. People with bulimia often have a normal body weight and they don't lose their menstrual periods, but they make themselves sick they make themselves vomit, self-induced vomiting, by putting their fingers down their throat. And it's the only sign in psychiatry that having calluses on the knuckles where they've caught their knuckles behind the front teeth, making themselves sick by putting their fingers down their throat. So vomiting. People who have severe bulimia nervosa can just make themselves vomit without putting their fingers down their throat, just at will if they want to. So they can vomit. And the other thing that they do is they abuse laxatives. They'll take large numbers of laxatives, which causes intestinal hurry, diarrhea and so on. So the food just pours in one end and pours out of the other without getting absorbed. So self-induced vomiting, abuse of laxatives, distorted body image. They think they're much fatter than they really are. They have what's called dysmorphophobia, which is a distorted body image, and constantly worrying about what they eat and whether it's going to make them fat. And there's a constant fear of gaining weight, the phobia of weight gain. That's bulimia nervosa. Again, by and large, the people have normal body weight. Then there's anorexia nervosa, which is actually a more severe form of the illness where the person is just starving themselves. And so again, they have distorted body image, body dysmorphophobia, vomiting, self-induced vomiting, abuse of laxatives, distorted body image, dysmorphophobia, and also lose weight. And so they often become very skeletal as their weight drops below 6 stone or so. They lose their periods, they have amenorrhea, which is loss of periods, so they become infertile. And so basically what they're doing in psychoanalytical terms is they're regressing to childhood. So these are usually young women who don't want to grow up, and so by regressing to childhood, by losing body weight, by losing their periods, they become childlike again. And so it's a way of I've had several girls where parents are threatened to leave when they grow up because they want the marriage to end. So the only way to keep the parents together is to remain as a child. So by remaining as a child, they don't grow up, and therefore the parents can't leave home. That's the sort of theory anyway. So certainly a very severe illness. Once the weight is down to that level, these people can die. They can die very easily of malnutrition, and frequently they have to be in hospital for long periods of time. They have to be forced to eat either with nasogastric tubes or intravenous fluids and food, and so on, in intensive eating disorder units. So that's anorexia nervosa. Compulsive eating is where the person can't stop eating, is constantly stuffing themselves with food. Often they're grossly overweight. They just constantly eat. They're obsessed. If they start eating something, they can't stop. They just carry on eating until everything's finished in sight. I had one woman who was in hospital trying to lose weight, and who was trying to lose weight, but was still gaining weight even though she was on only 1,000 calorie diet a day. And her husband every night brought a big suitcase in with her clothes in. And the nurses found that in actual fact, the suitcase was full of Mars bars. And every night when the nurses weren't around, she'd eat all the Mars bars, and all the packaging was put back into the suitcase the following morning, ready for the husband to take it away again, ready for the next night's session of eating all these Mars bars. So no wonder she never lost weight, because she was stuffing herself the whole time, secretly. And so it's secret compulsive eating. And then there's a newer types of eating disorder, one called orthorexia, which is a new disease, which isn't in the International Classification of Disease 10 or the Diagnostic Statistical Manual number 5, which is the American version, and the other one was the European version. And that's where the person has an obsession, this is more like an obsessive compulsive disorder, about what is healthy food. And so they spend their lives eating only healthy food. They won't eat anything unhealthy. And so they're very faddy about their food. They watch what they're eating very carefully, and therefore they can lose weight and develop anorexia or bulimia nervosa as part of this. But the key mechanism is a fear of eating any food which is unhealthy. So there's an obsession with being totally healthy. And that's orthorexia, as it's called. I'm sure there are other conditions, but by and large, the three that we treat, the first three that I just mentioned.